We've conducted 9 interviews so far and have about 14 more scheduled.
We've done 19 interviews so far.
Like 25, approaching 30 now.
We've conducted 18 interviews so far.
We completed 20 interviews with 2 pending right now.
Before, I kind of thought user need identification was just who's using our device specifically, or something that someone who may interact with our device on a daily basis. And I think now I've kind of seen that it's a lot more well-rounded.
It ranges from clinicians, professional engineers, and those clinicians are people like nurses, surgeons, other types of physicians, scrub techs, you name it. We've interviewed them.
We actually had very engaging conversations with them. And, we had a script originally, but a lot of the time we went very off script, and we really got into the details of things that were really important to them. And that really helped us make a lot of progress.
With our problem, it's interesting to hear from the users that have had some distance from the problem itself and hearing their perspective of it versus the users that are directly in the problem.
They're really busy people, but they're so excited to help, especially when it comes to education, and they always get so excited hearing about our project.
One thing that kind of, overall impacted my understanding was how variable the answers could be from different people you interview.
You're looking at so many different perspectives, and most people think, oh, the patient, the person who's getting treated on, and maybe the doctor are important. But I think I would agree with her that the biggest thing I've seen is that there are so many more people involved, so many different perspectives, so many different needs.
We were able to go into the OR and watch the process that we're working with, and that was just really cool to see how it actually works and how the patients interact with the providers and just how the entire system works, and really understanding it better.
Essential in the process of determining a problem statement and figuring out your future design inputs, design needs, and user needs.
So we had the opportunity to go visit a surgeon in the operating room over at Emory, and it was really awesome. It was a really awesome opportunity to be able to see that surgery in real time and get to interface with clinicians to sort of see what their day-to-day looks like.
And something that really stuck out to me was defining, doing the literature review and all of that is the absolute. It's sort of the absolute truth of what's out there. But adding that interview component and talking to people adds the emotional aspect.
So I think getting direct feedback from users, I think that's really made me a lot more intentional about focusing on what they need and value, because what we think as engineers, what we believe is the solution, that may not always be what the users are actually desiring.
Hearing directly from users has just made the whole process a little bit more personal to me.
During these interviews, to really focus on pulling out a pattern from all the noise. So really focusing on pulling out the pattern, the real need, the real issue from getting all these different interview perspectives.
And it was really nice to kind of be back to the humanizing side of it, and the why and the patient and the adverse effects that they experience, and be grounded back towards that.